we're not doctors. And we're not the parents of these kids. We're not the teachers of these kids. We're not the guardians of these children. These are discussions that should be between the parents, the doctors, and the kids.
Sure, yeah.
Not politicians. Not Daniel Smith, not somebody else saying that this is something that I should inject myself into. This is like any other form of healthcare, something that should be between the patients, the doctors, and the parents.
Let's talk about the parents, because even though obviously there's a whole basis of medical science behind this, we are seeing protests of parents protesting SOGI, sexual orientation and gender identity resources in schools. We are seeing parents coming out in support of these parental rights legislations across the country. What would you say to those parents who are concerned about these things?
I'd say that any parent's concern about the welfare of their children is completely valid. No one wants to take that away, and no one's trying to be on the other side of that issue. What the unfortunate reality is that people have been sold a narrative on this, in that it's simply much more dangerous, or something that is insidious, almost as if it is like an influence, a social contagion, a mind virus, something like that. It has nothing to do with that. The reported rates of people who identify as trans, even if that number is going up higher right now, that number, in the same way we used to persecute people who were left-handed, for example, right? If you look at the number of people who were left-handed and who reported being left-handed, that number spikes once we started, not saying people who are left-handed are sinister or the devil or stuff like that, but then it plateaus at about 12% of the population.
Right.
The same thing is happening right now to LGBTQ plus and trans people, who are now being, they feel they're safe in an environment to be able to talk about this, and they're reporting, much higher numbers.